Right now, your heart just beat, and you didn't decide it. Right now, one nerve is controlling your heart, your lungs, your gut, everything. Cut it, and your body starts shutting down. It didn't beat because your heart decided to beat. It beat because something told it to. A single nerve running from your brain into almost every major organ in your body. It touches your heart, your lungs, your stomach, your liver, even your mood. It is called the vagus nerve, and it is the most powerful single wire in your entire body. The vagus nerve starts in your brainstem, deep at the base of your skull. Then it travels down your neck, into your chest, and spreads through your abdomen. It connects your brain to your heart, lungs, stomach, liver, and intestines. No other nerve in your body covers this much ground. And here's the surprising part. Most of its signals go upward. Your organs are constantly talking to your brain through this nerve. This connection is called the gut-brain axis. It links your physical state directly to how you feel.
Why does anxiety affect your stomach?
Because the vagus nerve connects your brain and gut directly. Stress signals travel both ways. Let's be precise about something important before we go further. The complete removal of the vagus nerve, bilateral total vagotomy, is not a procedure any surgeon performs. It would be fatal. What does occur in surgical medicine is partial vagotomy, the deliberate cutting of specific branches of the vagus nerve for therapeutic reasons. And these cases give us the clearest window into what losing vagal function actually does to a living human body. Historically, the most common intentional vagotomy was performed on patients with severe peptic ulcers. The logic: the vagus nerve stimulates gastric acid secretion, so cutting the branch supply in the stomach, a truncal vagotomy, would reduce acid and allow ulcers to heal. Hundreds of thousands of these procedures were performed between the 1940s and the 1980s, before proton pump inhibitors made them largely obsolete. Those patients became, in effect, the largest involuntary cohort of partially vagus-severed humans in medical history. The vagus nerve can also be damaged unintentionally during surgeries of the neck, chest, and abdomen, thyroid surgery, carotid endarterectomy, esophagectomy, lung resection, all carry risk of vagal nerve injury. Even a difficult intubation during anesthesia can stretch or compress the vagus nerve at the neck, causing temporary or permanent dysfunction. The nerve can also be damaged by tumors, by severe viral infections, including certain strains of influenza and, in some documented cases, COVID-19, by diabetes causing autonomic neuropathy, and by blunt trauma to the neck or chest. In each of these cases, partial surgical section, intraoperative injury, or disease-related damage, the medical consequences give us a remarkably detailed map of what total vagal loss would produce. And it is one of the most complex cascades in all of human physiology. There is also a procedure called vagus nerve stimulation, VNS, which does the opposite. It electrically activates the nerve to treat epilepsy and treatment-resistant depression. The fact that activating the vagus nerve treats anxiety and depression tells you everything about what losing it would do to your mental state.
Can you feel vagus nerve damage immediately?
Not always, but symptoms like rapid heart rate, digestion issues, or voice changes appear quickly. The vagus nerve is removed. The silence that follows is not peaceful. It is catastrophic, and it arrives from every direction at once. The vagus nerve is the primary mechanism by which your brain slows your heart. It releases acetylcholine directly onto the sinoatrial node, your heart's natural pacemaker, instructing it to beat more slowly. Without this signal, your heart rate climbs and stays elevated permanently. This is called resting tachycardia. Your heart, now freed from its primary governor, hammers away at 100, 110, 120 beats per minute at rest. The constant elevated workload accelerates wear on the cardiac muscle. Over time, uncontrolled resting tachycardia dramatically increases the risk of arrhythmia and sudden cardiac death. The heart becomes a runaway engine. The vagus nerve regulates bronchial tone, the degree of constriction in your airways, and plays a role in the reflexive control of breathing rate and depth. Without it, bronchial smooth muscle loses its parasympathetic input. The lungs become hyperreactive to irritants. The cough reflex, which depends partly on vagal sensory fibers detecting irritants in the airway, is severely weakened. Aspiration, food and liquid entering the lungs silently, becomes a constant danger. The breathing pattern becomes irregular. Aspiration pneumonia would likely become the leading cause of death for someone living without vagal function. This is perhaps the most immediately debilitating consequence. The vagus nerve drives peristalsis, the rhythmic muscular contractions that move food from esophagus to stomach to intestine. Without it, the gut goes quiet. Food sits in the stomach instead of being processed. A condition called gastroparesis. Nausea is constant. Vomiting is frequent. Nutrition absorption collapses because the gut is no longer modal. The patient loses weight rapidly regardless of what they eat. Bloating, constipation, and intermittent diarrhea alternate without pattern. Historical vagotomy patients, even those who only had a partial truncal cut, commonly reported that their digestive quality of life never fully returned. The recurrent laryngeal nerve, the branch of the vagus that controls the intrinsic muscles of the larynx, would be severed with the vagus nerve. Both vocal cords would lose motor control. Without active muscular tension, the vocal cords cannot adduct to produce sound. The result is not a quieter voice. It is no functional voice at all. Additionally, the vocal cords would sit partially open, compromising the airway and making aspiration of food and liquids even more dangerous. Swallowing, which requires coordinated laryngeal elevation and epiglottic closure, will become deeply impaired. The vagus nerve is the anatomical foundation of what neuroscientist Stephen Porges calls polyvagaltheory, the idea that social engagement, emotional regulation, and the feeling of safety are all mediated through vagal tone. Without the vagus nerve, the parasympathetic calming system is gone. What remains is a nervous system in permanent sympathetic overdrive, perpetual fight or flight. Cortisol stays chronically elevated. The inflammatory response, which the vagus normally dampens to the cholinergic anti-inflammatory pathway, runs unchecked. The result is not simply anxiety. It is a neurological inability to feel calm, connected, or safe, ever. Depression of severe and treatment-resistant quality would be the near-universal consequence. Vagal dysfunction has documented links to disrupted estrogen metabolism, heightened inflammatory response in hormonal conditions like endometriosis, and disrupted regulation of the hypothalamic pituitary adrenal axis. Women with pre-existing hormonal conditions would face compounded consequences. Menstrual irregularity, heightened pain sensitivity, and increased susceptibility to autoimmune flare would all be expected outcomes of total vagal loss. The chronic resting tachycardia would disproportionately accelerate cardiovascular risk in men, who already carry higher baseline rates of cardiac events. Additionally, the vagus nerve plays a role in erectile function through parasympathetic innervation of the genitals. Vagal loss would cause significant erectile dysfunction that is neurogenic rather than vascular in origin, making it non-responsive to standard pharmacological treatments like PDE5 inhibitors. Fatigue would be profound and persistent. The honest summary: a human being cannot survive long-term without functioning vagus nerves. Life without them would be a cascade of system failures: cardiac, pulmonary, digestive, immunological, neurological, each accelerating the others. Survival, in any meaningful sense, will require mechanical and pharmaceutical support of almost every major physiological system simultaneously.
Can the vagus nerve be replaced or repaired?
No, it can be supported, but not fully replaced if completely lost. In reality, doctors never remove the entire vagus nerve, because losing it completely would be life-threatening. But parts of it can be damaged during surgery or disease. Even partial damage can cause serious problems. Doctors treat the symptoms, not the cause. Medications control heart rate. Other drugs help digestion. But no treatment replaces a nerve itself. 3 things most people never know about this nerve. First, it helps your body relax after stress. Second, it directly affects your mood. Third, it can actually be strengthened. Slow breathing activates it instantly. Cold water can trigger it. Exercise improves it over time. Social connection strengthens it. Your vagus nerve is working right now, slowing your heart, regulating your body, keeping you stable, without you even noticing. If this changed how you see your body, subscribe. Next, we'll remove something even more unexpected. See you next day.